welcome to the fourth and final Bronx Health Reach Coalition meeting for 2021. I hope you all had a wonderful Thanksgiving, and in the spirit of the Thanksgiving season, I want to tell you all first, thank you for all that you have done, both those who have partnered and collaborated with us on the many initiatives that Bronx Health Reach has been involved in over this year, and to thank you for all that you've been doing in your respective areas to improve the health of the Bronx and to promote health equity for communities such as the Bronx, who've been historically victims of health inequality. So a huge thank you to all of you. We so appreciate all that you have done. As has been our practice for many years, we look back at the year that we've done, share it with you, spotlight some of the key things. It's not everything, but some of the key things that we have been involved in collaboration and partnership with many of you. And then there's some folks who we want to applaud for the amazing work that they've been doing over the years, but particularly this year, 2021. So with that, again, a very warm welcome to having you with us in this December month, the end of 2021. COVID-19 has dominated our lives as it did last year. I think many of us had hoped, assumed that COVID-19 would be somewhat in the rearview mirror. Not so. So for Bronx Health Reach, we have, in addition to all the other work that we have been doing, we have been really focused on helping to minimize the risk and infection of COVID-19 in our community in several ways. So the number you see on this first slide is a number of vaccinations that the Bronx Health Reach COVID-19 team has been responsible for. So we just wanted to call out and identify the different streams of funding that Bronx Health Reach has received to work on the COVID-19 effort in the Bronx. So last year, August, the New York City Health and Hospital, New York State Department of Health had given out grants to do what they call T2, which is test and trace. Bronx Health Reach had been one of those initiatives that had been funded to do it. We assembled a team of community outreach workers who have just been phenomenal. The team has been led by Michael Johnson. And then CDC, early this year, back in March, April of 2021, provide supplemental funding on top of the REACH funding that we get to pay particular attention to doing outreach and engagement around COVID-19 vaccine. And that initiative is headed up by Mariah Burns-Zaloff and two community outreach workers. Recently lost one because of family obligations, and so we're looking to replace that person. And then the NIH gave funding to an assemblage of entities in New York, and that is the New York City Community Engagement Alliance at COVID-19 Disparities, for short, New York seal. And so part of that involvement on our part has involved collaborating with Montefiore to do surveys and focus groups to identify what are the issues and concerns that community members have that make them resistant to getting the vaccine, and then having that information inform the strategy and tactics that we use in our community engagement. Next slide, Michael. So what we're showing here is several of the outreach efforts that our team has been involved in, whether it's the H&H funding effort, whether it's our CDC funded effort, or our New York or NYC SEAL effort. As I said, we've done over 6,600 COVID-19 vaccines, working with some of the Institute's health centers, working with New York City Department of Health vaccination sites. One of the things I want to call out, because the fact that we're a community coalition is not just in name, but in reality, we've had some really astounding collaborations with several business groups in the Bronx, individuals with their own business. I want to particularly call out Stop and Shop, Bronx Terminal Market, Universal Hip Hop Museum, we worked with the Taste of Dominican Food Festival folks, the Darussalam Islamic Center, Islamic Cultural Center of the Bronx, Nuevo Shalom Restaurant, Luz Beauty Salon, and Majestic Beauty Salon, to name but a few. We also had, at the beginning, when we were doing test and trace, many of our faith-based organizations reached out to us because they wanted to be test and trace sites. And then when the vaccines came out, they reached out again because they also wanted to address the community needs to get vaccine. And one of those organizations that we want to point to is Walker Memorial Baptist Church, that has been at the forefront of this effort to get as many people both tested and vaccinated. Our team has given out over 150,000 masks to over 500 faith-based organizations, schools, and small businesses, whether they be bodegas, barbershops, nail salons. In addition, we have done 150 street surveys to, as I mentioned before, to identify the concerns that community members had with the COVID-19 vaccine. We use those surveys as well as some focus groups we did to learn particularly why some particular population groups the data was showing that their vaccination rates were really low, which led us to focus on several initiatives, which we will cover in a little while. We have convened a vaccination community advisory board. Mariah has done presentations to several groups, providing them with COVID-19 vaccinations. Those groups amount to about 500 people that we have been able to do these presentations to. We've also, which has been key to this community effort, trained community partners in order to increase our community outreach and engagement. Next slide, Michael. Again, some of these highlight some of the efforts where people some were looking for places to get their COVID-19 vaccine, and some had questions And based on the answers that our community outreach team gave them, they decided to get their COVID-19 vaccine. Next slide, Michael. These are examples of some of the collaborations that we have been involved in getting out the vaccines. Next slide. So before we go on to this one, I wanted, bear with me one second. I'm going to ask Mariah just to talk a little bit about the work that we did under the New York SEAL effort and that collaboration. Mariah?
Yes, thank you, Charmaine. So we worked with Montefiore primarily on the focus groups. The surveys were actually 150 surveys were done through the CDC grant. We worked with Montefiore through the NYCL NIH grant to conduct 7 discussion groups. And these discussion groups were part of a community research study called Bridging Research, Accurate Information, and Dialogue. And the main themes that we found from our 7 discussion groups were the strong influence mothers have over their sons in getting vaccinated. We also found that we also found that there was mistrust in the healthcare system and healthcare providers. Definitely a need for more time to talk to providers and ask questions and hear those answers in everyday language. People felt that the 5 minutes or 10 minutes they were getting with their doctors really wasn't enough to explore their questions. A need for better reading material written for a patient audience without all the technical language. Also, they had a lot of concerns about the misinformation being spread about COVID-19 vaccines and the need for more accessible information. You probably see a theme within the themes here. Reliance, a lot of people relied on older people in their community or people that they knew who had health-seeking behaviors for health information over health professionals. And finally, they talked about vaccination as a choice for control over their own body, and how the mandates or being pushed to get it was seen as a negative thing. And they preferred to hear language that talked about choice. We also participated in a community health worker training, preparing the slides and the presentation for a community health worker training that was led by Mount Sinai and in cooperation with NYU. And we that was shared with 35 community health workers. It was a great initiative, and hopefully it'll be available to the public more widely soon. Thank you, Charmaine.
Thank you, Mariah. Next slide, Michael. So you heard Mariah mention that one of the points that came out in the survey and the discussions and focus groups was that spoke to the poor rates of vaccination among young African American and Latino men. And we also learned culturally the importance that these young men placed on their mothers and wanting to protect their mothers wherever possible. And so that idea was the inspiration for the I Got Vaccinated for My Mom campaign that we mounted in collaboration with FYI, a New York City-based nonprofit advertising organization that has just been an amazing partner with us. We will cover some of the other things that they have done with us in the past. But the I Got Vaccinated for My Mom effort involved 4 pairs of mother and sons that were in the age group from 18 to 44 in the Bronx, African American and Latino young men and their mothers. This campaign was mounted on the back of buses and also on the Link NYC kiosk. And we, again, to call out the amazing collaboration with FYI, they got us free of cost those Link NYC kiosks that we were able to put this campaign on, a total of 100. So much thanks to them for that effort. And then finally, with the our COVID-19 review, one of the things that we have been, it's not in any of, specifically called out in any of the work that we have been doing, but Joseph Ellis, one of our longtime Bronx Health Reach staff members, who is a senior community outreach worker, has had a particular passion for men's health. Last year, in collaboration with Dr. Eric Gale, the Chief Medical Officer for the Institute for Family Health, Joseph and Dr. Gale had a men's only health meeting. And so this year we decided, particularly how we had seen the low rates of vaccination among men, that Dr. Gale and Joseph Ellis would work on having a men's COVID town hall meeting. And so I'm going to ask Joseph and Mariah to talk about this. They both worked on this together. Joseph and Mariah?
I'll start off and then you can join in, Joseph. I mean, this is really mostly Joseph's connections and passion for this that drove this event. So a lot of the credit goes to him as well. In November, we hosted a second annual men's health workshop with 15 participants to address men's COVID vaccine concerns. And the guest speaker was Dr. Julian Watkins of the Health Equity. He's the Health Equity Advisor for Department of Health. And we had a panel of speakers available. Really, the focus was just to answer questions and not talk at people, but just have a conversation. And the panelists were Dr. Oladi Oki, a family practice physician at Montefiore, Brett Scudder, founder, president, and chairman of Scudder Intervention Services Foundation and Suicide Institute, Reverend John Udan Okan, who's senior pastor of Word of Life Christian Fellowship International, and executive director of Word of Life International. And then, of course, Joseph, do you want to talk about the facilitators?
Can pull that up right now, but the facilitators were really good. Some of the feedback was that, can you hear me?
Yes.
Some of the feedback was that it was really necessary and important to address the issues that men have. And those that do outreach or work with men know that men can be very difficult to reach and to gather together. So that we were able to do this was fantastic. And a lot of credit definitely goes to Mariah for getting our facilitators together. And they were so willing to come on board because they know the importance of reaching out to the men and the questions that they may have that women may not necessarily have. So it was important and to address these issues, but it's equally important that there were a lot of women, just like in the first workshop we had, that want to come on and hear the questions that men have and or take care of men or are caretakers to men and want to be able to help them address their health issues even more. So I applaud the efforts that we are doing, and it was definitely a success much outreach goes to these events. We don't always get the participation, but we did, I think, about 35 churches, 3 mosques, trying to reach men across the board to address their issues. So thank you.
And we will have, thank you, Joseph, and we will have the video. Originally, we were going to keep it private, but because the participants agreed to share it, we will be able to share the video with those who weren't able to participate. So we can share it more widely with other men so that they can see it. And maybe we can even have another session on COVID or another men's health topic. And I also wanted to highlight, of course, that Joseph Ellis was a facilitator along with Dr. Eric Gale, and they did an excellent job leading this conversation and really getting people to open up, which was wonderful, by opening up themselves. And I just wanted to quote that somebody who gave us some feedback, Paul Johnson, he said that it's really, it's good to have things explained to you so you can have a clearer knowledge and trust to move forward in decision making. And he just applauded the doctors and pastors for their wisdom and really felt like, you know, this was a place, a circle of trust where people could talk openly. And it was really a wonderful conversation. Thank you.
And can I
Go ahead, Joseph.
Mariah, and one of the things that comes out of these workshops is that the doctors or facilitators, they're not talking at you, but they're talking to you, and they're sharing even from their own experiences as medical professionals, the questions across the board and the people across the board that they're dealing with and helping to address their concerns and their fears. So thank you again.
Thank you, Joseph. Thank you, Mariah, for that reporting. The last thing I want to say before we move off the this area around the COVID-19 work that we've been doing, about 2 weeks ago, our outreach team, which included our newest team member, Barbara Toledano, did a vaccine effort where 50 people got vaccinated. That's an amazing thing to have happen. And it shows what we have learned over this, 22 years of Bronx Health Reach, that it's the folks who come particularly out of the community who have that level of trust, who provide the first listen really intently to what community residents are saying, to the fears that they're expressing, the concerns that they have, and then who speak to those fears and concerns in a manner that presents both the facts as well as is not dismissive of people's concerns and fears, that has proven such a successful recipe for us being able to tell the fact that we have been responsible for more than 6,600 vaccinations being given out. So again, kudos to the team. Our next review topic is around nutrition, the particular food systems and nutrition. And we're going to, you can go to the next one, Michael. Food service guidelines and what has been happening in that area, as our Healthy Pantry initiative, our the Farm Share program, our Health Bucks efforts, the mindful eating that we've done. We're going to have the staff responsible for these efforts to very briefly and succinctly review what has happened in this year. Rachel and Immaculata.
So this year, through our food service guidelines work, we were able to host 2 trainings through our Healthy Pantry initiative, thanks to our contractor, Jarrell Owens. The Healthy Pantry training covers the nuts and bolts of how to run a food pantry And most importantly, we're focused on how to implement the food service guidelines with the focus of including procurement of healthier foods and creating a healthier environment. The 2 new sites we trained this year were Bethel Temple of Yahweh and New Covenant Community Development Corporation. This included a 1-day virtual training and technical assistance to adopt a nutrition policy and start using the Plentiful app, which is a phone app to schedule appointments at the food pantry to make operations run more efficiently. In this year, New Covenant Community Development also was able to reintroduce a client choice model, which allows clients at the pantry to choose to have more autonomy over what products they get from the pantry, which was on hold due to COVID-19 social distancing restrictions. Previous sites from our year past Manna of Life Ministries. Oh, actually, Ima, do you want to take over?
Sure. Good morning, everybody. As Rachel was mentioning, or started mentioning, the Man of Life Ministries and Resurrection of Life Pentecostal Church were first last year's sites, previous sites, I mean, and they continued to implement the food service guidelines and utilize the Plentiful app. And finally, with the support from Growing YC, Man of Life, if you want to move to the next slide, Man of Life built a garden to help supplement the fruits and vegetables offered at the food pantry and has a space for the community to learn, as you will see from the pictures.
I think we can move to the next slide. So moving on to another initiative, our Farm Share program. We were recently, as of November, able to implement another Farm Share program, which allows participants to purchase a bag of produce by paying the week before. And so through a collaboration, the different initiative, Morrisania WIC, and our partners, Corbin Health Food Project, we have started this Farm Share program at Morrisania WIC, and participants can purchase a bag of fresh produce that are local and high quality. And the primary participants right now are WIC participants, staff at this site, and nearby residents. In our first distribution, we had 55 people participate. And our second, we had 49. And just to keep in mind that this was around Thanksgiving. In years past with this Farm Share program, we've had around, on average, 25 participants. So this program is doubling that number and off to a great start. It's a wonderful partnership, and we're really excited about it. Next slide.
Oh, Immaculata, HealthWorks program.
Yes, so I want to highlight all of our partners are part of our faith-based outreach initiative, doing an amazing job applying for health bucks, distributing health bucks, and promoting the farmers markets. Specifically this year, we have 15 partners so far, part of this outreach initiative, who have distributed an astounding 5,250 health bucks coupons at this farmers market. As most of you might know, health bucks are $2 coupons used to purchase fruits and vegetables at New York City farmers markets. So our partners did walking tours, and they've completed 23 farmers markets walking tours with a total of 324 participants. As you will see here, this is Walker Memorial Baptist Church. They received an impressive 600 health bucks coupons, and this site completed 4 walking tours with 60 participants. Next slide, thank you. And another one of our partners, Church of Life Community Church, received 400 coupons completed 3 walking tours with 100 participants. You will see here the health coordinator from that site handing out the coupons at the farmers markets, either to people from the community or from their church or in the neighborhood that were just there that day. Thank you. Next slide.
Thank you, Matlava. Before Kelly comes in and speaks about the mindful eating, I just want to point out that this Health Box program has been a remarkable success in the few years that we and our partners, particular partners, have been involved in it. They have distributed and used almost 16,000 health bucks. For those of you not familiar with health bucks, it's a means by where through the New York City Department of Health, community residents that have limited access to fresh fruits and vegetables get to go to the farmers markets in their neighborhood and purchase those fresh produce. So to be able to say that our partners have distributed and have had those health bucks redeemed over 15,000, almost 16,000, is something that our partners should be applauded on such a really great move. And just as a bit of a historical fact, it was actually the Bronx District Public Health Office that first initiated the idea of health bucks that is now a citywide initiative. So we're particularly happy to be part of this effort. The next slide will be on mindful eating for the beloved community, an initiative that we got involved in through the work of Kelly Molson, who will speak a little bit about that effort. Kelly?
Yeah, thanks, Charmaine. So this year we started a partnership with BCA Global with Alex Askew, the president and CEO. He has written a book, Mindful Eating for the Beloved Community, which is a collection of essays. And so we worked with him to create a program for faith-based organizations that included, it was a 9-session program and included skill building and mindful eating, cooking demonstrations, information about food systems, the history of sugar, and opportunities to get involved with food justice and food policy campaigns. Overall, basically working to discuss building the beloved community by Reverend Dr. Martin Luther King Jr. through creating a food system that is rooted in health and justice, health and food justice. And members of Bronx Health Reach's faith-based outreach initiative participated, with St. Helena hosting the program, and then Word of Life, Welcome Memorial Baptist Church, Church of God Prophecy, and Sacred Heart all participating in the program as well. Next slide.
Okay. Thank you, Kelly. As I think most of you who have been involved with Bronx Health Reach knows that going back, I don't know, in the very early years of Bronx Health Reach, we have been focused on working with bodegas since they're so ubiquitous and commonplace in the Bronx, working with them to increase access to healthy food. In addition to the work that we've been doing around fresh produce, working with them to just offer healthier food, 100% fruit juice, products that have less salt, less fat, etc. So in April, the council member Vanessa Gibson, who is our soon-to-be inaugurated Bronx Borough President, kudos to her, first woman, first African American to hold that chief executive position in the Bronx, held a press conference to promote the idea of an expansion of the Healthy Bodega program. Bronx Health Reach, along Bronx Works, the Bodega and Small Business Group joined the council member in that call to action for that expanded Healthy Bodega program. It came at the same time we heard that legislation was being drafted that would, in a sense, codify this effort by creating a license for bodega owners who had attended the best practice trainings to become what Bronx Health Reach termed hero bodegas, hero standing for healthy, educated, responsive, and operational. So we were really excited about this effort. We saw it as a real milestone in what we had been working on for several years. Some of you may remember in past year in reviews, we had talked about the formation of a Bronx Bodega work group that had consisted of ourselves, Bronx Works, Montefiore, to name a few. So this was having a proposed legislation was something that we thought, wow, this was significant. Unfortunately, we can't report, at least at this point, that the legislation has moved on. It encountered a roadblock, and so the legislator who had been behind sponsoring the legislation has decided to step away from sponsoring that legislation because of some other priorities they've identified. However, we have been in this fight too long and so have not given up working with it. We have committed to continue to work with the Bodega and Small Business Group, which is the group representing the Bodega Association, along with the food advocates, and hopefully recruit some legislators to continue this effort to create the kind of business environment for the bodegas in the Bronx, but also bodegas across the city in supporting healthy food. Next slide, Michael. Before we go on to this, the last thing I want to say about our work in food systems. Kelly Molson, who you had heard speak just before on the mindful eating, has also been heavily involved in conversations with our local health action center, with New York City Economic Development Corporation, with Hunts Point, the Bodega and Small Business Group Association, on work that involves looking at Mayor de Blasio's 10-year food policy plan, as well as a grab it and go project, all with the idea of how can we effect some systemic change in the food systems work that will make access to healthy food, increase access to healthy food in the Bronx and in our community. So our next slide, Rachel will walk us through what has been happening with our breastfeeding initiative. Rachel.
Thank you, Charmaine. So for our breastfeeding initiative, for the month of August, which is National Breastfeeding Month, Morris Sadie & Wick hosted several different activities, including a health fair, a globalette, which is the picture that you see on the screen now, and a few other events, including Indigenous Milk Medicine Week, which highlights the power of and respect for those who share human milk as medicine in Indigenous culture. We also, Morris Sadie & Wick also hosted Black Breastfeeding Week, The topics covered were health inequities that manifest in higher necrotizing and enterocolitis infections and deaths in NICUs with predominantly Black infants, as well as the racialized inequity that these families are much less likely to have, which leads to these families having much less access to donor milk for their premature or sick infants. The Morrisania Wick Baby Cafe this year hosted 28 BHR sponsored baby cafes, 5 of which were working edition baby cafes, which occurred in the early evening after work hours, with a total of 197 participants. And our partner, Albert Einstein College of Medicine, was able to conduct 5 breastfeeding trainings, which were hosted at work sites or community spaces to encourage breastfeeding and provide a safe space for breastfeeding. These partner sites included Thrive Bronx of Sun River Health, Morris Heights, My First Experience Daycare, Chabahamos Head Start, and Lisette's Daycare. Charmaine, we can move to the next slide.
Rachel, you want to stay on because you're going to walk us through some of the highlights of our active living work. So I think all of you know that in addition to us placing emphasis and doing a lot of work around healthy eating, which you just heard us report on, we're also very involved in increasing opportunities for physical activity in the Bronx. And this includes a number of initiatives that Rachel will start walking us through.
Thank you, Charmaine. So firstly, this year, Bronx River Alliance, through collaboration with Bronx Health Reach and Bronx River Alliance, we were able to conduct an evaluation, which has been designed and implemented to assess Starlight Park usership, which is part of the Bronx River Greenway Trails, Parks and Trail, Greenway Park, I should say, to assess Starlight Park usership and utilization post-completion of phase 2, stage 1. So just to be clear, the whole park is being renovated, and so we're evaluating some of the new phases being implemented, which includes a new bridge crossing in the west and east banks. For this evaluation, which occurred in November, 99 people completed an intercept survey and a SOPARK survey of the park, which stands for Systems for Observing Play and Recreation in the Communities, was conducted on 4 separate days. So just to be clear, this is really about park usership, how many people are at the park and how it's being utilized, so that ultimately we can determine this and see if there's any feedback from community members on other ways that we would like to utilize it, or if park usership has gone up because of these changes. 400 Bronx residents have been included in this evaluation study of the Bronx River Greenway Parks and Trail usership and utilization. We are soon to analyze this data, and the results will report to the CDC and in a peer-reviewed manuscript. Next slide, please. So through a surprising grant from the New York State Division of Criminal Justice Service Office of Program Development and Funding, and our partnership with Bronx River Alliance, we were able to create a new mural that was installed in Concrete Plant Park. The mural was designed by Stephanie Vidal and Fernando Leon and included the theme Feeding Your Soul and Finding Your Zen. It is inspired by Concrete Plant Park and the wealth of activities and opportunities it gives to the community to connect with nature. The imagery walks you through the park trail, navigating through the food forest, neighboring plants, and the Bronx River Foodway. This work depicts what inclusive community wellness can look like for the Bronx River community. This design was voted on by local youth along with the muralist who created the design. Local youth also helped with the installation and painting of the mural. With a small portion of the funding, Bronx River Alliance will also be able to host 3 wellness events, including an herbalism workshop, healing drumming circle, and sound healing workshop, and an Indigenous dance performance by local Indigenous leaders. These events will be able to bring the literal imagery from this mural to life and catalyze conversations around what inclusive community wellness looks like. Thank you. Next slide, Kelly.
Before Kelly reviews what we have done in this area, I just want to underscore the fact that, as Rachel had said, it was a surprising funding. We learned, and we don't know who was the generous benefactor to us. We just got notification that a funding line was inserted in the New York State Division of Criminal Justice Services for us to get this small funding to implement or support an effort that would go towards encouraging youth that may be at risk for the juvenile justice system. So thank you. Big thanks to the New York State Division of Criminal Justice for this funding. And thank you to the Bronx River Alliance that, because of the collaboration we have had with them over the years, we were able to have this mural painted that engaged so much of the community in the design and the implementation, and that will not only beautify a part of the park with what has been done on this structure, but that it will also, as Rachel just explained, allow us to have some new connections, some additional connections that will be of benefit to the folks. So just wanted to give a special shout out to the New York State Division of Criminal Justice. Kelly will walk us through the work that we've been doing with another longtime collaborator of ours, Transportation Alternatives. Kelly?
Yeah, so we've also been working with Transportation Alternatives on ways to improve active living, specifically around improving complete streets. So one of the projects has been around gaining support for complete street transformation of Boston Road. And this year, Transportation Alternatives was able to secure almost 2,000 signatures for the Boston Road project. They also identified 2 new partners, Rain Senior Center and Bronx Messenger, to help gain support for this work. And Council Member Kevin Riley provided a press release on September 28th, supporting the complete streets transformation of Boston Road. Next slide. And our partner, St. Helena Catholic Church, is working to gain support for complete streets changes at the intersection between White Plains Road and Westchester Avenue. This intersection needs a total transformation with curb cuts, better lighting, more signage, and painted crosswalks. So far, there's been 164 petition signatures collected. Next slide. TA's Bronx activists organized a family-friendly ride on March 20th that toured the High Bridge and Harlem River waterfront. This family-friendly bike ride included a helmet giveaway and free city bike access to encourage riders of all ages and experiences to participate. They had approximately 100 bike riders and pedestrians join for this event. Next slide. Oh, okay, I'll just use this. Sorry. NTA hosted a virtual and self-paced bike ride called Bike the Boroughs in April, including a 26-mile bike ride route that was accessible for riders of all ages. The route traversed the Grand Concourse to showcase the complete streets phases across Boston Road and highlighted several murals and public spaces in the borough. We had a total of approximately 230 riders sign up for self-paced borough rides in the month of April. Okay.
Thank you, Kelly. So in addition to those initiatives that we've been reporting on, there have been others that we have been involved in, and we're just going to do a quick review of those. Next slide, Michael. So Mariah is going to provide us with an update, but just as a bit of background, one of the wonderful unexpected outcomes of the REACH initiative, which I think most of you, if not all of you know, comes out of CDC, is that because the REACH effort is embedded in the community, in communities, particularly communities that have been marked by inequities and health disparity. There are other divisions within CDC recognize the significance of having this community-based effort. And so with the pandemic and the focus on immunization, first starting with COVID-19 vaccine, and then a particular attention now, like, oh, we could do something around flu. The Division of Immunization Services within CDC, though it's not the home for REACH, partnered with the division that is the home for REACH to provide supplemental funding to REACH grantees such as Bronx Health Reach, the Institute for Family Health, to launch an effort around increasing the rate of flu vaccines in areas where the rates are particularly low. And that coming out of this effort is our Bronx Flu Fighters campaign, which Mariah will now do a quick review on. Mariah?
Yes, hi, thank you, Charmaine. So the Bronx Flu Fighters campaign, which this is our second launch of the campaign, to increase the rate of flu vaccinations in the Bronx. We're really excited. We've hosted in the past year, we've hosted webinars with churches, mosques, schools, senior centers, and local politicians to provide information about the flu and vaccinations that we've been giving. We've worked with over 600 people, providing the education and the resources through these webinars. And then additionally, we've been doing, last year we did 7 community vaccination events in cooperation with Walgreens, and reopened our flu clinic at Stevenson Family Health Center to do flu clinics last year. This year, we're working with 3 flu clinics actually at 3 of our Institute for Family Health sites, at Stevenson Family Health Center, at Mount Hope Family Practice, and Walton Family Health Center. And we're really excited to get that going. The launch of our flu campaign will be next Monday at Mount Hope. There'll be giveaway bags, there's going to be a photo booth, and of course, vaccines and educational information. So I encourage everybody to come and get vaccinated on Monday at Mount Hope, and this is the flyer. And then also you'll have an opportunity to get your free flu vaccine on Wednesday, this Wednesday at Walton, from 9 to 11, or you can go to on Tuesday to Stevenson Family Health Center. Those are our 3 locations, and Stevenson is from 1 to 4:30, and that will be every week. Walton will be, the schedule will be week by week. We'll provide that information. But I hope you come and get vaccinated. And if you have questions, we do presentations. So please come or contact us for information.
Thank you, Mariah. So our next report out is on our Latino Health Initiative. Several years ago, we were funded by New York State Department of Health on a hypertension initiative that we embedded in our faith-based work. Since that time, we received funding from New York State Department of Health for the Latino Health Initiative, and we took what we had done with that NYC DOH funded effort around hypertension that was principally for English speaking faith-based organizations, and we have now done that with faith-based organizations, but with our Latino faith-based group, and Immaculata, who heads up that effort, will give a brief review of what it has been like this year. Immaculata?
Yes, so our Latino Health Initiative is a faith-based hypertension initiative that focuses on the Latino community in the Bronx. Corazón Saludable, Vida Saludable uses community education to improve the health and prevent hypertension for at-risk or high at-risk community members. A train-the-trainer model was used to have participants recruit leaders to be trained as peer educators and recruit 10 to 12 participants and implement the program. 6 partners made up the 83 participants that completed the peer educators training and implemented the program. Partners included St. Augustine, Our Lady Victory Church, pictured here, St. Helena's, St. Thomas Dock Church, Holy Spirit Church, St. Jerome's Hands, also pictured here, and Eastside Houses. Participants reported changing their eating habits to control their blood pressure, reducing sodium consumption to help lower their blood pressure, using herbs and spices, and eating more whole grains and vegetables. Recently, 6 new partners were recruited to complete the peer educators training and implement the program from November 2021 till January 2022. They are New Settlement Community Center, New Life Rehoboth Church, Glory of Christ Church, Thessalonian Baptist Church, San Am Episcopal Church, and the Church of God of Zambia. Thank you.
Thank you, Immaculata. Next slide. Oh, right. So several years ago, the City Council provided us with funding to, with a particular emphasis on the immigrant community, including undocumented immigrants. And so the goal of this effort has been to improve access to healthcare, to address cultural and language barriers to that healthcare, and to point to the resources and interventions that the immigrant community may not be aware of or may not think that they have access to. So one of the areas, as I mentioned, we have been really working through our community outreach team, is to assist immigrant victims of trauma and exploitation through several of the services that the Institute provides. Our outreach team has been working with the Institute to provide, to connect folks to the Institute so that whether or not they have insurance, they can get healthcare. We're a federally qualified health center network, and so that's one of the charges that we have with such a designation. The outreach team has been working with several local organizations, over 100, almost closer to 200 organizations, to provide outreach, do in-person events, distribute information, use many of the local media outlets in the immigrant population to disseminate information about the fact that people can have access to healthcare irrespective of their immigration status. So we're particularly, once again, showcases the importance of a community outreach team. Next slide. So many of you know that Bronx Health Reach is one of the founding members of the Not 62 campaign for a healthy Bronx. Last year, we were supposed to mark the 5th anniversary of that campaign, which sort of really had its genesis when we received a Robert Wood Johnson Culture of Health Prize. However, because of COVID and us sort of having to pay attention to how we needed to meet the needs of the community around COVID-19, we put off recognizing the 5th anniversary. This April, we were able to do so. The partners involved in that, the Borough President's Office, Montefiore, Bronx Health Reach, and of course, the Bronx Health Action Center had, though it was virtual, a really an event that had us look back at what this effort, particularly the steering committee, has been able to accomplish over the past 5 years. We had as our goal that we would be a multi-sectoral coalition working on the issues that the issues and factors that contribute to our poor health outcomes. At this event, we had Senator Gustavo Rivera, Bronx Borough President Ruben Diaz Jr., and Dr. Jane Bedell speak again to what we have done, what have been our focus, what has been our development over the past 5 years. And then we had Professor Nick Freudenberg, Distinguished Professor of Public Health at CUNY, who has been a phenomenal friend to this effort over the years, be our keynote speaker. And if you were not present as part of that virtual audience to hear him, we encourage you to, his presentation was taped. We also have his presentation that we can share with you. We encourage you to go and either listen or read it, because what he did was he took us on a time travel to a Bronx in 2026, where some of the prevailing health conditions, health challenges that we contend with now were significantly reduced, and where more Bronx residents were living healthier lives. And then in that travel, he challenged us to think about the strategies that need to be put in place, the strategies that we can design and implement for such a future of a healthier Bronx, no longer ranked 62 out of the 62 counties in New York State would become a reality. And it was aspirational, but it's also something that we could really wrap our arms around and our heads around and think what do we need to do to make that happen. Next slide, Michael. So the Health Disparity Work Group of Bronx Health Reach is the home for Bronx Health Reach's work in the Not 62 campaign. And if any of you have attended any of our previous 3 coalition meetings for the year, you would know that in addition to our overriding focus on how do we address and eliminate health disparities and establish health equity, this year we had a consistent theme of paying particular attention to not only health behaviors and the social and economic factors that are big contributors to our health, but also paid attention to what is now a rising contention that political determinants of health are just as significant. And we have paid particular attention to that this year because we knew that while last year the nation paid attention to the presidential elections, for those of us in New York City and the Bronx, this year was had particular pivotal elections: the election of a new mayor, the election of a new borough president, and the election of many city council members, because many of the current Bronx City Council members were term limited and there would be significant turnover. So that the health disparity work group placed a lot of their energy in getting out the vote. And to do that, we partnered, and you will hear again a name that I've mentioned earlier. We partnered with FYI to do a communications campaign that highlighted, that spotlighted rather the importance of us voting. That voting was one way of raising our voice about saying that we are looking for and expect to see the sort of change that needs to happen that can only come from our elected officials. So what you're looking here is the Bronx Vote for a Healthy June 22nd. It was part of our the primary election effort. And this was projected at an event that was held by the Mayor Get Out the Vote effort at Union Square. So we took it even outside the physical geographic boundaries of the Bronx, and through, again, auspices of FYI, we were able to do this. We sent out talking points to our faith-based leaders for them to speak on the issue of the importance of voting in the November 2nd elections. And what you're seeing here are the talking points that we shared with those faith-based leaders. Next slide. So before we move, the one thing that the last thing I'd like to say about our Get Out the Vote effort, I don't know if you all saw some of the reporting afterwards that pointed out we had some of the lowest voter turnout. Clearly, there is a lot to be done to impress on Bronx residents that their votes matter, that they need to come out and vote so that those who get elected to office understand that voters are mentioned and will hold them accountable. So one of the things the Health Disparity Work Group will consider is how do we partner with folks like the NAACP who came and spoke at our October coalition meeting on their Get Out the Vote effort. How do we partner with others in a nonpartisan way to persuade Bronx residents that it is imperative for them to go out and vote? So that is our long-range view of this work that needs to continue. So we have a new funded effort, the Sweet Truth campaign, that Kelly will walk us through.
Yeah, so thanks, Charmaine. So this year, Bronx Health Reach has been collaborating with Center for Science and the Public Interest to push for a campaign that would require sugar warning labels in New York City chain restaurants with products with more than a day's worth of added sugar. And this is INT 1326 in New York City Council. And Teens for Food Justice has also been involved in this initiative in getting students across the city, especially in the Bronx, motivated around this campaign. And also Bronx Health Reach partners, including Reverend Teresa Oliver and Dr. Vanessa Salcedo, spoke at a city council press conference in support of this campaign in October. And to date, 23 city council members have signed on in support of the bill. Next slide.
Michael?
So as Charmaine mentioned, FYI, they were involved in sort of a few of the initiatives. Obviously, you saw the Health Disparity Work Group, you saw the COVID-19. Again, we are honored to work with FYI, a New York City-based nonprofit advertising organization. They enhanced our initiatives by creating a video and powerful messaging that captured the vital work we're doing and reaching out to the various communities in the Bronx. What you're looking at here is for the Immigrant Health Initiative. They, with feedback from our community health workers, you know, we were able to sort of create just stunning visual messaging in various languages. As Charmaine had mentioned, for the voting, these were some of the images that were created as well, not 62, and just, you know, impressing upon people that, like Charmaine had said, the importance of, you know, not just voting every 4 years for the president. If anything, it's most important to vote for, you know, the people who are literally in your backyard of, you know, your representatives. And again, this was the I got vaccinated for my mom campaign. Charmaine, you want to just finish up with media coverage, or?
Yes, Michael, you want to go on to the media coverage?
Sure. So, and as always, you know, just amazed the work that we're doing. You know, we appreciate that the media highlights our work, whether it's, you know, again, Charmaine with BronxNet appearing, promoting, you know, the importance of voting, our Bronx Times with the Bodega, Councilmember Gibson and our Bodega partners, and even with Sheku and Felix being featured on New York One and WNBC. I believe Sheku and Felix, you're seeking a talent manager because you're so much in demand anyway. And also Reverend Pastor John Uda Okan, he's the senior pastor and executive director from our coalition partner Word of Life. He was featured in the New York Times article, A Safe Space, Black Pastors Promoting Vaccinations from the Pulpit, about the importance of Bronx residents getting the COVID-19 vaccine.
As started off by saying at the very beginning of this coalition meeting, none of the work that we just reviewed with you, none of it, absolutely none of it could have been done without the partners and collaborators that we have been working with this year in particular, but over the many previous years. So a huge thank you, huge appreciation to all our partners for all that you are doing to make the Bronx a healthier place to have, to realize the slogan that we have for Bronx Health Reach, to make health equity a reality. Thank you. Next slide, Michael. And of course, to do this, we need our funders. And so thank you to all our funders, to CDC, to New York State Department of Health, which provided us with 2 new funding efforts. One was a renewal, the Creating Healthy Schools and Communities Initiative, the 5-year effort that ended last year. There was a pause in determining if that was going to be refunded for another 5 years. We learned mid-year this year that yes, New York State Department of Health was going to continue it. And then a new effort coming out of the National Association of Chronic Disease Directors through New York State Department of Health, also provided us funding in the initiative, specifically building resilient and inclusive communities. We want to thank New York City Health and Hospital Corporation and New York City Department of Health and Mental Hygiene that has been the support for our test and trace efforts and part of our COVID-19, as you had learned in one of the earlier slides. New York City Council for the Immigrant Health Initiative, the NYSEAL folks, as part of this NIH-funded effort around COVID-19 disparities. You heard me mention the Center for Science in the Public Interest, CSPI, that has funded us for that effort. And then a new we're a part of that the main grantee is the Corbin Hill cooperative. I think is Corbin Hill's name. I may just have added the cooperative in my own mind, but we are one of the subcontractors under grant. So much thanks, much appreciation to the funders for making all of this possible. So looking forward to 2022. Much is happening in 2022 because of the leadership that the city and the Bronx will have. I think if ever there's a wonderful point in history where we have an opportunity to that we may not see come again anytime soon, because not only do we have this new leadership, we have the kind of federal leadership that will support what we're trying to do in our respective organization, our respective work, and in the collective work that we're doing as part of Bronx Health Reach. We have a new governor. My gosh, we have Dr. Mary Bassett, who is now. Can you get me to the top? Somebody needs to mute their mic or their phone. We have the new governor. We have Dr. Mary Bassett. It is a fortuitous time for us. And so as we look toward 2022, my charge to us, my call to action is, how will we advantage? How will we take advantage of this set of opportunities presented to us so that coming out of this period, we will have significantly addressed the many factors that have held us at the bottom of the barrel in terms of our health outcomes, that have made it so that we have been 62 out of 62 counties in New York State in poor health outcomes and those factors that contribute to them. We will not get together in the new year until March, which means 2 months have passed. 2 months would have passed in the new year. I'm hoping that when we get together in March, and I would love to have your input, because this is not only a community-based coalition, it's a community-led coalition. Your input in how we address the many factors, whether it's the food system, it's our community environment that will support more active living, all the things that we talked about. How should we be, what new ideas should we be incorporating, looking at as we set forth in our new year, given the fact that we have all worked in a once in a century pandemic. There is much food for thought and much for us to set out for ourselves to work on come the new year. That being said, it's not the end of our coalition meeting. Thank you, Dawn. It's not the end of our coalition meeting because we want to call out some of those partners that have made all of this work possible. So we are going to go on to the next part of our agenda, which we're calling recognition awards. We wish, thank you. We wish that we could be doing this in person and being able to applaud and hug each other. We can at least applaud each other. So under the COVID-19 efforts, I've said this before, it's worth repeating, that for the phenomenal community outreach team that we've had, Felix Roja, Sheku Umar Ann, Barbara Toledano, Joseph Ellis, and the leadership provided by Michael Johnson and Mariah Burns-Zaloff has just been amazing. Just amazing. What they have done in the areas that we have focused on is one of those that you hear about sort of the unwritten history of successes. I consider what they have done in this time of COVID-19, things that may not be in the published history books, but should be recognized for what they have worked many times, 7 days a week, morning, noons, evening, all kind of circumstances to help people to stay healthy within this COVID-19 pandemic that we've had. So I'm watching our time. I don't know if anybody in the group wants to quickly, very, very quickly say anything.
Felix, would you like to just, because you always seem to be a man of many words, so Felix.
Morning, guys. Hi. Bye. No, just thanks for everybody. Thanks for the team. Thanks for Miss Roddick, lovely Miss Roddick, to Michael Johnson, to Mariah, to my partner in crime, Chequan Umar, to Immaculada Moronta. Who else? Barbara Toledano. She's the baby of our team. I've been with Bronx Health Reach for the last I'm bad at years, but 5-6 years, and to me it has been the most wonderful college, university, meeting so many people for so many backgrounds. To me, I remember I started with baby steps, and now I feel like walking right next to dinosaurs. I learned so much, and I hope, and I keep praying that this team is gonna keep growing. And thanks again, Miss Roddick, for trusting in me, and Michael Johnson and Mariah. It's been so wonderful to work with Mariah. I learned so much from you guys, and I'm so blessed. I'm so blessed. So thanks, team. Thank you.
Thank you, Felix. Sheku, did you want to say anything? Yes.
Yes, okay. Just like Felix said, okay, I'm very happy and very proud to work for Bronx Health Reach. Well, I call it the one-stop, for real. I call it a one-stop where we can do everything at Bronx Health Reach, from nutrition, social services, housing, helping on COVID, testing, insurance, healthcare. We do everything that the community needs. So we work 7 days, just like we say, 7 days, 24 hours. And I'm sometimes very grateful about everything they do, because that's what we like to do. Me and Felix and Joseph, we all like to do what we do. We do it every day of hours, and then we're loving it. And then we have a wonderful team being backed up by somebody very strict. That's Michael Johnson, like very harassing us all the time, but we're loving it. That's what we love to do. So I'm thanking everybody. And then I'm getting the grateful and the thank for all the community I work with, from Muslim, Christian, all everybody. Like we say, God is for everybody. God is for Muslim, Christian, Protestant, whatever, Jewish. So we enjoying what we work, and we just thank also ourselves for helping these people get elected, like the mayor and Vanessa Gibson. So we did a lot of work with them, and they thank us all the time we meet them for helping them get to where they are right now. Okay, we thank everybody, and we enjoy this meeting. Thank you so much.
Thank you, Sheku. We also wanted to recognize some of our community partners that, as I mentioned when I was doing the review, have just been amazing. So I want to forgive me if I mess up the pronunciation of some of these names. So Akari Kamara and Abigail Wagu, Mashid Marcus Sakafi is from Islamic Cultural Center, Candida Guzman Vizcano from and Luz Beauty Salon and Barbershop, Dalila Abreu, El Nuevo Shalom Restaurant, Council Member Cabrera, who was a outstanding partner in terms, particularly around test and efforts. He made available to the team so many PPE equipment, be it masks or hand sanitizers, that the team was able to distribute to hundreds, if not thousands. So a special thank you to the council member and his chief of staff. And we want to also recognize Flora Golson from Walker Memorial Baptist Church for what she did in the COVID-19 era, and also in addition to what she has done with the with Health Bucks and the farmers market tours. Is anybody in that list I just call that want to say one or two words?
Charmaine, Mr. Kamara is here, I believe. So if he'd like to share some words with us.
Good morning, everyone. This is Bakri Kamara. I am the public relation of the Markaz Sakhafi. The English version of this Sakhafi is Islamic Cultural Center of New York. Our masajids, we have about 12 of them that are linked together. This vaccination effort has been very helpful, and the utensils that are given to us were very helpful. Yesterday, I got a whole bunch of them again from the warehouse. When we started these at the beginning, when I heard that our area here, Mauritania area of the Bronx, was lacking folks vaccinated, we made an announcement in the mosque. And also your members there, Sekou and others, my wife also coming from Lincoln Hospital and also being involved in this community efforts, were very helpful in enlightening the community and having to have the people come and get vaccinated. Your program, Stay Alive, and it's very useful. And all of the other efforts you are involved in, be that is, people to go to vote or eating healthy or education efforts, those are cornerstones of the community. So this is, I would say, a thumbs up for your organization and health department and other efforts that are being made to make sure that people are healthy, people are save lives from COVID-19 and also from hunger, and educating their children, at the same time getting involved in election efforts. I thank you all very much from the bottom of my heart on behalf of my community, Islamic Cultural Center of the Bronx. I thank you.
Mara, we thank you and appreciate you greatly for all that you have done in your collaborations with us to make the Bronx a much healthier place. Thank you so much.
Yeah, you're welcome.
Anybody else from the group I just mentioned who's on would like to say a few words? Okay, I'm going to move on because I'm mindful of our time. The Bronx Flu Fighters campaign wanted to just express our appreciation to Pastor Earl McKay from Church of God of Prophecy, whose church he so graciously allowed us to use to launch the first annual campaign last December, and who has been one of those quiet, powerful partners with Bronx Health Reach on so many initiatives that we have been involved in. I want to particularly say to the group that Pastor McKay has been sick with COVID. Sandra, correct me if I am wrong, but yes, Pastor McKay is sick with COVID. I think he is still in the hospital. Is that correct? So I want us just particularly to lift up Reverend McKay in our thoughts. He leads a church that, in addition to serving the best Jamaican soup I've had outside of my family, has done, wow, there are no words for what Reverend McKay and his church has done in that community, including something I learned of only because we went there for one of our health disparity work group meetings, and it's that his church opens their doors for when it gets cold for anybody in the community to come in and have food and shelter. Just a phenomenal partner. So in addition to just recognizing him for what he has done with us, specifically around on the Bronx Flu Fighters campaign, it's also to send him all our prayers and thoughts and good wishes for his speedy and full recovery. Next, for our Not 62 campaign, we wanted to recognize Sandra Jenkins from Church of God of Prophecy and Barbara Estrin for the leadership and vision and energy they have put into the health disparity work groups efforts around Not 62 campaign. I know Sandra is on. Sandra, did you want to say a few words? Only if you want to, no pressure.
No, never pressure in this group, thank God. It's just been such a privilege to be able to work with Bronx Health Reach, the resources, the support that they provide. I mean, there's no way to quantify how valuable they are, and the people, their commitment to our community that our church serves is just amazing. And we're so grateful to be able to work together with them to help our community. And I'm just very thankful for all of the hard work, the resources, and the commitment from this group, Bronx Health Reach, and the staff there. And we look forward to continuing. Particularly, we're excited about addressing those political and social determinants of Bronx health during this time, because as Charmaine has said, it's one of those moments in time that may not come readily soon. So we're looking forward to not being tired, but rolling up our sleeves and pressing on. God bless all of you, and thank you for remembering our pastor in your prayers.
Thank you, Sandra, and great appreciation for all that you do. Next, we are recognizing Gladys Roman from Manor of Life for her work on the work that they've done on the food service guidelines, a healthy pantry initiative, and also that garden that they started, and we saw those wonderful pictures. I know I saw Gladys on at one point. Gladys, if you're still on and want to say a few words, please do so.
Yes, good morning, everyone. Just want to say that I want to thank you for the support that you've given us. Because of your support, we're able to provide food, healthier food, and we're able to do it with dignity. You know, treating our participants with dignity is what's most important to me of all. Because when you're on a line waiting for food, sometimes in the cold, sometimes for a long time, it can really be demoralizing. As a little girl, I remember it was me on the line with my grandmother who only spoke Spanish, and she always made me ask for extra food, which was used to kill me. I used to beg her, please don't do that. And then she said, but there's so many of us, we need that food. So because of the Healthy Pantry Initiative, the garden has brought so much life to that corner. And my dream for next year is that it's going to look like a little part of the botanical garden. I want it to be that beautiful, just as beautiful as the botanical garden is. I want that corner to be equally beautiful, that everyone that goes by will smile and know that they are loved and remembered on our little corner. So thank you for helping me to do that, because that makes me happy. Thank you.
Gladys, thank you so much for everything that you do that, as you said, brings such dignity to our fellow community residents. So thank you. You're deeply appreciated. We're going to move on. The Latina Health Outreach Initiative, we're recognizing and appreciating Maria Peguero for all that she and her faith-based organization has accomplished with that effort. Is Maria on?
Yes, I am.
Hey, Maria, do you want to say a few words?
Yes. Oh, I am very grateful to be part of this family. I thank God for giving me this opportunity to work with my community and to work with the Bronx can be healthy. And I am very grateful to you, Charmaine, and all Bronx Health Reach to give me this opportunity to work together as a family, and especially to do something positive for our community. I am very grateful and I'm very happy to be collaborating with this. I think it never will be enough, but thank God that he gave me the opportunity, and you too, to do something positive for our community. Thank you so much.
Thank you, Maria, for all that you have been doing over the many, many, many years. Long before the Latina Health Outreach Initiative, you've been part of Bronx Health Reach's faith-based initiative, and you've been so faithful to the work that you've been doing in your church and the surrounding community. So we appreciate all that you've been doing.
You're welcome. You're welcome. I would like to do more, but I try to keep doing something. And I ask God for all of you too, for you continue to doing a very good job, because I can think sometimes that many people around the world could do many things good, but they are not doing. And thank God he chose us to do something, yes. And I ask him to help us to do more and better.
Thank you, Maria. Well said. Well said. To do more and to do better. Couldn't say it better. Yeah. We're recognizing and Nathan Hunter from Bronx River Alliance for the work that they have been doing. Is Nathan on?
Yes. Thank you so much, Charmaine, for creating space and uplifting our work. This was an exciting opportunity. And as you mentioned, the funding was kind of sudden, which was exciting for us just to have the opportunity to partner again beyond the work that Daniel was leading with the park usership surveys. But a real pleasure always to work with you all. And the process of installation of the mural and working with the artists and kind of bringing together all these different engagement aspects was really exciting and was a real learning opportunity for us as a non-arts based organization to navigate, like, how do we incorporate art into this work and uplift so many different aspects of what we're doing along the Bronx River in this culminating project. So yeah, thank you for giving us the opportunity to do this, and we look forward to, you know, finding other ways to make these opportunities, you know, come together.
Absolutely. Thank you. Thank you, Nathan. Thank you for your efforts and for Bronx River Alliance. We so appreciate all that you have meant to us in the collaborations that we have been doing over the last few years, especially with this one and the mural. The next folks that we want to recognize and express our appreciation for what they've been doing, Alex Askew and Father David Powers for the work that they did, particularly around the mindful eating for the beloved community. I know I saw Father Powers' Alex Askew on.
Yes, I'm here.
All right, so Alex, you want to go first and then Father David?
Father David, you can go first. I think I'd like to follow you.
All right, really good. I think that eating is something we all have to do. And I think for most of us, eating has become rote. Eating has become mechanical. Oftentimes, eating is something that we do on our way to something else. I guess when I was younger, the family sitting around the table, eating together, eating healthy, having good conversations was the norm. But I don't know if that really is the norm in so many households. And one of the things I think that contributes to the unhealthy situation many of us find ourselves in. So are we going to be mindful of what it is we are eating? Are we going to be mindful of how it is that we eat? And I think this program helped answer some of those questions and bring some of those points to light, so that hopefully people will now not only be thinking about what they are eating, but how they're eating it.
Thank you, Father David.
Okay, so I guess I can go. I just want to, have a state of message of just humbleness and honor that we were able to use mindful eating for the beloved community as a construct for community health and well-being, because it's 360 degrees. And so, working with Father David, working with, the group to really look at how we can bring a sense of well-being, and to Father David's point, answer those questions that most people don't really ask themselves in terms of a relationship with food. It's all about a relationship. Having a good relationship with food lends itself to better health. A poor relationship with food, exactly the opposite. So on behalf of BCA Global, which is one of the longest standing organizations around racial equity in the culinary arts, and the Mindful Eating Beloved Community Program, which was very successful. And again, thank you, Father David, for your insight and working together. And for all those that haven't seen his interview, it was very, very, I would say, full of light and perspective of what everyone needs to understand, that it's on an individual, family, and a community level, and a healthy community is a more productive community. And, that makes everyone, women, children, aging well, senior populations, at risk, vulnerable populations, they are all part of a community that is all interconnected and can't be separated, although the system will try to do this to us all the time. And food is centric. Food is centric to be celebrated at the table for discussion, for spiritual and thought. And, that is really the part that we need to continue to focus on in terms of social determinants of health and the well-being, the holistic well-being of the mind, body, and spirit. So thank you very much. I really do appreciate that we had a chance to launch the first interfaith mindful eating for the beloved community program, which even for me, I learned a lot about the different perspectives of food and faith. And so I'm very appreciative. Thank you.
Thank you. Thank you so much, Alex and Father David, for this work that you did on this initiative. Our next appreciation is for Lois Godfrey. Lois has been with Bronx Health Reach Coalition since I want to say 2001. But in this particular instance, we are spotlighting our appreciation for Lois on the work she did with the Godfrey Family Connect, the African Heritage and Health Workshops. Lois, I saw you on. Do you want to say a few words? Lois?
She's trying to unmute.
Okay, I'm here. Thank you, Charmaine. Yes, thank you so much. Like you said, I've been with Bronx Health Reach for a very long time, and that accounts for a lot of the information that I've learned and how I look at making decisions about our community and some of the kinds of things that complicates us having access to healthy food and what have you. So last year, I think my worst nightmare was when I heard on CNN and MSNBC, like high blood pressure and diabetes, and the folks who would be likely to have the greatest problems with COVID for people who had those pre-existing conditions. So I'm sitting there saying, we're hearing this for the first time. As long as we've been working with diabetes and high blood pressure, we've not had any knowledge of COVID. So now we got to link them all together, and this problem is just going to get more complicated and more difficult. And then I'm sitting there saying, well, but they're talking about my family. They're talking about my family. So what can I do? So I decided that one of the ways in which I could share and educate and open up the idea of health disparity and racism was to recruit my family members and create something that would be called Godfrey Connect, which is the name of the family, pull them all together from my father's side of the family and have them meet once a month, and that I would write a curriculum to address some of the kinds of concerns that I thought would be of help to them, like the health disparity piece that never heard of it. We don't think about that. So how am I going to gain their interest and motivation? My family's quite young. I'm at the top. The oldest, the average age is probably about 45. And I'm trying to come up with something that's going to bring them in and draw them in. So I decided to go back to their ancestors, which were in my father and his mom and father, in which many of my family members may or may not have met, may not have known. I thought that if I did that, I could introduce the lifestyle, I could introduce how they lived, I could introduce eating from the land, growing from scratch, and use all of those kinds of things in which they were interested in, hearing about Aunt Curly and Aunt Judy and Grandma this, and talk about that's what they did. And so we used that approach I did in a way of dealing with diabetes and high blood pressure. So it was really to go back to cooking, go back to eating natural food, and they learn more about processed food. So I was able to work with them for a good amount of time. And during that time, I was also involved with the mindset eating for the beloved community. And it was just so perfect to make them aware that I was working with my family in Alabama. And oh, by the way, I'd gone to Alabama at that time. So I had a real opportunity to go back and experience what it was like to be there now and how to access healthy food and really work with them. So I was also able to share the work that I've done with my family with the mindful eating for the beloved community. That is essentially what we did. And I can tell you that the next big piece for bringing them together is something that's we're going to call Nieces Getaway. I have 10 nieces that I like to bring together and to engage them in moving forward with everything that we've learned and how they can continue to link the family and continue to provide them with an incentive and motivation to want to eat healthy. So that is what it was, Charmaine.
Thank you, Lois. Thank you so much for all that you have to improve healthy eating in so many in the Bronx. We deeply appreciate your work. I next want to recognize and appreciate Dr. Eric Gale for the work he did with our Men's Health COVID Town Hall. Dr. Gale is unable to join us this morning, but we still wanted to recognize and appreciate him. Nancy Keck from the Bronx Borough President Office, she was with us, but had to jump off because she had another appointment. But this appreciation for Nancy Keck is not only the work that she has been doing with the Not 62 Steering Committee, but Bronx Health Reach has a particular interest in Nancy Keck because we have taken credit for the borough president hiring her as his health director. And why? Because in 2019, when we met with the borough president, that position had been unfilled for more than 2 years. And we met with him in December 2019, pointed that out to him. It was one of our asks. And then we heard in January that in fact they had recruited and filled that position. We are really grateful for what Nancy has brought into that role, for her leadership. We are publicly advocating that the incoming borough president considers having her remain in that role. She has spearheaded Black maternal health initiatives, something that we are all deeply concerned about in the Bronx, given the high rates we have of poor maternal health and poor maternal health outcomes. So we just wanted to publicly thank Nancy for all that she has been doing in the Not 62 campaign effort and in other health-related issues. She's been a real partner. You've heard us talk throughout this morning's meeting about FYI. I can't think of any other words that we can use except to say how great FYI has been in partnering with us. There's some groups you work with that just, I don't know, fall in love with you and you fall in love with them. And they have been a group that has fallen in love with Bronx Health Reach and has been up there with us creating these amazing communications campaign, bringing in resources to us that we could not afford, but they have utilized connections that they have to showcase our work. So a special thank you to FYI, to Jessica Toledano, Andrea Wilson, Calder Zwicky, and Lena Bard. I thought I saw at least Calder on. Calder,
Yeah, we have Calder on, Charmaine, yeah.
Calder, you want to say a few words?
Sure. Thank you for that, Charmaine. It's great to be back in touch. We are so proud of the work we've done with Bronx Health Reach. It's been some of our favorite campaigns we've ever worked on, and the response to it throughout the communities and to the artists and to the people we share the program with ourselves. Everyone is just so amazed with what we were able to accomplish together. I got vaccinated for my mom campaign always brings a smile to everyone's face. And I have to say, the same way that Felix and Cheku are looking for talent managers, Charmaine is moving into her own ad agency, because that was 100% her idea during one of our brainstorming sessions. And we think it resonates so well across all the communities we've been sharing it with. I want to say Link NYC was very generous, and we were able to extend the life of this campaign on over 100 Link NYC screens. That wasn't because of anything we did. That was because of Link NYC seeing the importance of this campaign and seeing the vision of what Bronx Health Reach is trying to accomplish with vaccination awareness in their community. We are here to help anyone else on the call who wants assistance or wants to work with us. But Charmaine, thank you. Your team is very special, and we just love being a part of it. There was also a StoryCorps piece that was done with the participants, as well as with Felix and Cheku. Check that out. StoryCorps was also excited to help us share the life of this campaign, and we look forward to working with you all in the future. Thank you all.
I just want to add real quick, briefly, for those people, you might be, if you have a car and you're behind a city bus, some of the ads are still up. I mean, a couple days ago, it was supposed to do a 4-week run, but I saw a few buses go by. So if you see it, take a picture, put it on your social media, and hashtag it, I got vaccinated for my mom.
And you don't even have to have a car, because we've gotten pictures that people have taken who are at a bus stop or walking and saw the bus, saw the back of the buses and took the pictures and sent to us. So huge appreciation to FYI and all that they have done with us over this past year. I know we are 2 minutes over, and I really try to keep us on time, but I would be remiss if I did not give a big shout out and appreciation to Teresa Landau and the breastfeeding initiative that she's spearheading at the Morrisania WIC site. Teresa, if you're still on. I know she was.
Of course I'm still on, and I will be brief, which will be an anomaly, right?
I know.
I will, but what I just want to say is every year you guys blow me away with the breadth and depth of what Bronx Health Reach does and accomplishes. You guys are truly, truly an inspiration. I love it. And one of my, Charmaine, one of my favorite groups. Bronx Health Reach and all the partners really epitomize Margaret Mead's famous quote that never doubt that a small group of committed individuals can change the world. Indeed, that's the only thing that has, and that really defines Bronx Health Reach. So thank you for the partnerships. Rachel, thank you for being such an amazing partner with us. We love working with you. Just for everyone to know, we have Baby Cafe on every Thursday, 11 o'clock English, 1 o'clock Spanish, and reach out to Bronx Reach. We'll give you more information about that, but we help families achieve their breastfeeding goals. And we were the first Baby Cafe in New York State to pivot 2 days after the pause was called in 2020 to a virtual venue. And it has been just a wonderful, wonderful experience. I'm going to just add one thing about the farm share. If anyone wants to know about our farm share in collaboration reach out to Bronx Health Reach and they'll reach out with me. It's welcome for everyone in the community. And we're looking for some volunteers to help with packing because we're doing it in a COVID safe manner. Distributions every other Tuesday and payment on the alternate Tuesday. So thank you, Bronx Health Reach, and thank you all the partners. You guys are amazing. I wish you a happy holiday season.
Thank you, Teresa. Teresa goes back years with us. We're just spotlighting our appreciation for the work that she is doing in collaboration with us around breastfeeding. But Teresa has been one of our biggest fans and leading the cheer for us. And we appreciate you, Teresa, in so many ways. And have been an amazing coalition member with us, an amazing member. One of our newest, community outreach worker, Barbara Toledano, sent a wonderful text a couple of weeks ago. I had mentioned that they were doing an outreach in collaboration, I think, with one of the small businesses, and were able to get 50 people vaccinated. And Barbara sent this wonderful text to the team about how much she appreciated having the opportunity to do for her community. And so I know Barbara wanted to say a few words. I'm going to ask Barbara to be extremely brief because I'm mindful of that we have ran a few minutes over our time. Barbara, if you're still on.
Yes. I'm more than happy and blessed to be part of Bronx Health Reach. My partner, all of you, I just gonna say thank you. This is a great opportunity to be in the community, to talk to the people, to listen to them. I never feel like so like enjoying it, like joy and very blessed, because when you hear someone who just need to clarify something about the vaccine, and you can be there for them, and it's amazing opportunity. I'm more than blessed. Thank you, all of you. Thank you, Mariah. Thank you, Felice. Thank you, Sheikhu. Thank you, Charmaine. Thank you, all of you, because this has really touched my life, and it's a bless.
Thank you, Bob. Thank you so much. You and the team are so appreciated for all you have done in the Bronx. It would be absolutely remiss of me if I did not thank the entire Bronx Health Reach staff for the work that they have done over this year and previous years, but this year they have called on their creativity as we navigate this unique set of circumstances that COVID-19 has put us in. They've brought their A game to the work, and I deeply appreciate all that they have done. Joseph, Mariah, Michael, Barbara, Immaculata, Rachel, Kelly, just has been a real honor working with this amazing staff. So I could not let this opportunity go without publicly thanking you for all that you have done and will continue to do to make health equity a reality in the Bronx. And so with that being said, I want to wish every one of you that's here with us, that put all that you had into making a success of the work that we're doing. We know, I think Teresa was so right to remind us that of that Margaret Mead quote, that it has been a small group of dedicated people that have made possible any of the changes that we that we have benefited from as a society and a community. So on behalf of Bronx Health Reach, the Institute for Family Health, the team and everybody, I just want to say a huge thank you. Be safe, be well, and we will see each other in the new year. Take care. Be good to yourself. Bye-bye.